is the taxonomic and diagnostic tool published by the American Psychiatric Association, or APA. It is a manual for assessment and diagnosis of mental disorders and does not include any information or guidelines in treatment of any mental disorders. So one of the mental disorders in DSM-5 is the eating disorder. The DSM-5 lists eating disorder under the category of feeding and eating disorder, and describes that they are characterized by a persistent disturbance of eating or eating-related behavior that results in altered consumption or absorption of food that significantly impairs physical health and psychosocial functioning.
There are different types of eating disorder. One of these is binge eating disorder, characterized by recurring episodes of eating large amount of food in a short time, and the sense of lack of control over eating during the episode. Another eating disorder is anorexia nervosa. Anorexia nervosa is characterized by an intense fear of gaining weight or becoming fat, and a distorted body image that leads to extreme dieting.
Bulimia nervosa is a serious, potentially life-threatening eating disorder. People with bulimia may secretly binge eat large amounts of food with a loss of control over the eating, and then purge to get rid of that extra calorie in a way that is unhealthy. Avoidant restrictive food intake disorder, or AFRID, is a new diagnosis in the DSM-5 and was previously referred to as selective eating disorder. ARFID is similar to anorexia in that both disorder involves limitation in amount and or types of food consumed, but unlike anorexia, ARFID, it does not involve any distress about body shape or size or fears of fat.
The third type of eating disorder is what we call pica. Pica is an eating disorder marked by eating non-food items. It is commonly seen in childhood but can occur in adulthood. Type of eating disorder is what we call rumination disorder. Rumination disorder or rumination eating disorder is the regurgitation of food, possibly chewing it and then re-swallowing the food. There are a lot of ways to cope up with eating disorder. First is getting out. Spending even 10 to 15 minutes outside getting fresh air can be a great reset during a hectic day. Meditation and yoga. Meditation and yoga can be a relaxing way to calm the body down and feeling stressed. Mindfulness. Slow your eating to enjoy your meal more and say at least one positive thing about yourself each day to boost your confidence. And lastly, counseling. Counseling can be a great way to get help from health professionals when dealing with an eating disorder.